Hello, I'm Dr. Marwan Saifi. Today I'm going to be talking about the two known techniques in hair restoration surgery, FUT, follicular unit extraction, and FUE, follicular unit excision, or the former name known as follicular unit extraction. FUT is basically we remove a strip of the scalp from the occipital area, and we prepare the grafts under the microscope in singles or two hair follicles or three hairs. Utilizing the FUT technique can be really tricky and can be important. You have to make the decision here depending on the laxity of the scalp, depending on the skills the surgeon has. It's amazing stuff. We talked about this many times. I'm sure you guys saw many videos by well-known doctors talking about the FUT technique. It's great. Some doctors do it with single blade, which I prefer personally. Some doctors try to use a double blade. The old times they used the 4 blades, which I didn't like because it can cause some transection and so forth. The single blade is great. We measure, we make sure that we get the right width, and we make sure that the closure will be with no tension. I use a single layer. Some doctors use, I use a 2 layers closure. Some doctors use single layer. It doesn't matter. The point is to approximate the edges and get the right closure. Additionally, I prefer to do a trichophytic closure, which means one edge of that wound is epithelialized, removing part of the upper or the lower part in order to get the hair coming straight out from the scar itself. It's a great technique and we see great results. Why we use, sometimes we use the single hair. Where do we use single hairs? We try to find the finest hair for the hairline. I would say like about the first ½ centimeter, we use this natural zigzag shape, feathery hair to give this natural look. And then we move to the defined zone and the frontal tuft, which are crucial areas. And we use grafts with 2 hairs, with 3 hairs, sometimes even with 4 hairs to give the good density and natural look. FUE technique. FUE technique, it's a little bit different. It's a funny story. I just like to say it here. Many patients come to me and say, "Doc, we want to have surgery, but we want this new technique, the new procedure." I say, "Hi, I'm surprised. You want the FUT, the strip, the scar?" He said, no, I know the new one, the other. I said, okay. Actually, the new one is the strip, and we look in the past, but the FUE, we used to use it before. But we used to use the bigger punch with grafts with 10, 15 hairs. Now, of course, it's much better. It's refined. We use small punch. We get sometimes a single hair, a follicular unit with 2 or 3 hairs. So yes, the old and new technique, it's the same, but it's a different understanding. FUE is nice. Some people like to have short hair, so probably it's better to have FUE, depending on the density, the laxity of the scalp. Some people are afraid of the cut or the surgical part of the FUT, so we do the FUE. But again, it doesn't mean that you have to go blindly and to get every single part of the donor area. You have to skip every third, every fourth, and every second in order to create a natural look with a small punch, depending on the hair diameter, the density. So you want to make sure when the patient has his hair shorter, it doesn't show anything, or at least without closer inspection, you can't see much there. Both techniques are great. One more thing I would like to add, I noticed recently with a patient who came for his third surgery. And I looked at my notes, and when I did the first one, I wrote that the donor area wasn't that great. This time he had a fantastic donor area. I was surprised. Most of the graft I harvested were 2s and 3s. And the reason was the way we treated the donor area during the last 2 years using supporting treatments such as the CR lab products, the help hair protein shake and vitamins, the low-level laser therapy, PRP, anything. The topical PRP was great as well. So after the first surgery, do not stop taking care of your donor area, because as we mentioned before, it's the most important part of the whole story. Good donor area, good results. So please make sure that you treat the whole scalp well. Healthy scalp means healthy hair. So use the stuff the doctor prescribed, the doctor recommend, and everything should be fine. Thank you.